morning, ladies and gentlemen, and welcome to the first Medal podcast that we have. And today we have a very special guest with us. He goes by the name of Dr. Ahmed Al-Imadi. Good morning, doctor.
Good morning.
Dr. Ahmed, it's a pleasure having you with us here today. Would you like to introduce yourself to our audience, please?
I'm Dr. Ahmed Al-Imadi.
Yes.
I'm a consultant otologist and cochlear implant surgeon. I started my training journey all the way back in 1988 in UK. I did my medical school there, and then after that I did my basic surgical training, which was in ear, nose and throat. After finishing my basic surgical training, I completed my higher surgical training in Canada, in Toronto University. I did a specialty of otology, which means the surgery of the ears, and neurotology, which is the surgery of nerve of hearing and balance. After that, I came back to UAE in 2000. So I've been here for 25 years operating on patients, mainly in the ear and implanting cochlear implants. I'm currently elected as the president of ENT Society, and I'm associate professor at the University of Sharjah. I'm a visiting cochlear implant surgeon and several hospitals at the moment. I operate in Dubai, in Kuwait Hospital. I'm a visiting cochlear implant surgeon in Sheikh Khalifa Medical City in Abu Dhabi, and also at the University Hospital in Sharjah. Basically, my daily work is doing my clinic, which is based in Wafi City Center, and I do see mainly patients with hearing and balance problems. And my operations, as I told you, in these different hospitals. That's it, basically.
Thank you very much for that brief, doctor. It's amazing to have you here, for especially someone who's been in the industry. I wouldn't even call it an industry. I would say, like, you come from such a vast, background. 25 years is a long time. Especially, we always see technology constantly changing, and you've been here like since the beginning. So I do want to ask you, in a nutshell, what is your daily life in terms of work? How does that look like?
It is actually quite busy because I operate in many hospitals, and also I do consult in different places as well. So every day is a different clinic, different hospitals. I start my day usually on some days I do consultations in my private clinic, and sometimes I do consultation in the government hospitals, such as in Kuwaiti Hospital Dubai, or in Sheikh Khalifa Hospital in Abu Dhabi. And then there are days that I start early with my surgeries, starting with ear surgeries. Not all my surgeries are cochlear implant. I do a lot of complicated ear operations, as well as implanting hearing devices. And so it's basically a mix of surgeries with consultations, basically.
Doctor, just a very interesting question that you just mentioned, cochlear implants. For the people who are not into the medical, or don't really have a medical background, can you please elaborate what exactly is the cochlear implants?
Yeah, so basically you have two different types of hearing loss. We call it basically conductive hearing loss, or a sensory neural hearing loss. The conductive hearing loss means that the sound cannot reach the cochlea. It's a conductive problem. And in these situations, we actually implant different type of implantable device. It's not cochlear implant, and this helps the sound to reach the cochlea. And then we have the cochlear implant, where the patient's cochlea is not working. It's either the cells are deteriorated and dead, or actually they didn't from the beginning they didn't develop these hair cells which is receive the sound.
You mean from the time they were born?
It's like congenital. It's either congenital or later on in life developed
with age and stuff. Right.
So if the patient's cochlea is not working, then now we have the technology to replace that by cochlear implant. So insert a device into the cochlea, which replace these hair cells, these cells that receive the sound. So we give electrical stimulation to the nerve directly by the cochlear implant. So basically we are bypassing the cochlea. So we're directly putting the sound into the patient's cochlear nerve, which goes directly to the brain. So this is the basic concept of cochlear implant, that we are bypassing the cochlea. The cochlea has been damaged and somehow, and we are replacing the cochlea.
And at what stage does someone who's suffering from hearing loss should actually consider such implementations?
Usually the hearing loss is, there are degrees of hearing loss.
Okay.
So if you have a mild or moderate hearing loss, usually we go to hearing aids first.
Correct, okay.
So when the hearing aids fails for the severe and profound hearing loss, then we consider cochlear implant. We have degrees, and we actually rely more on speech understanding rather than sounds. So we say if the speech understanding with the maximum aided ear is less than 50%, then we go for cochlear implant. So that means if you cannot understand the speech, 50% of the words you cannot understand, and you are wearing your hearing aid, the best hearing aid, and you cannot understand 50% of my speech, then you should consider going for cochlear implant.
That's a very interesting I actually wanted to ask you, because when you're talking about the speech, I was going to ask you, how is that related to the hearing?
Yeah, we test that actually in the lab. So when the patient comes in, we put the hearing aid on, and we give them different words in the lab, in the audiometry lab, and we test how many of these words they correctly repeat. So if they repeat the words more than 50% correctly, that means that they are getting enough with the hearing aid. But if it's less than 50%, usually they are struggling. If they cannot understand the speech, then they have to consider a cochlear implant.
I like that. I think it's very interesting that we, you know, it's like, it's not just immediately someone comes in, it's like, okay, we're going to be doing this. No, you actually have to go and, you know, do like a test to see if they need to go that far or not. That's a very interesting. Now, I do have something to do with, I want to ask you something in the patient's journey, for example. What are the signs that the hearing aids are no longer enough and it's time to consider a cochlear implant? I would say it's the part where you just mentioned the speech part.
Yeah, I think the patients themselves and the family around the patient, they will start asking questions. Is there something else that we can do? Because the patient cannot communicate. They cannot understand their family members. If they have meetings, for example, they cannot get the gist of the meeting, and they miss a lot of things in the conversation. So it's either the patient or the family that approach us. We have the elderly patients who are reluctant to come forward. The family, the daughter or son or grandson, they come and say that we are struggling communicating with her at home.
The loud TV, when they speak, it's quite loud.
Yeah, exactly. So they come forward and they ask if there is anything else we can do. We usually, at that situation, first of all, we have to check the hearing aid. Make sure it's properly programmed. It's the best hearing aid for that type of hearing loss. Because not every hearing loss needs the same hearing aid. Every hearing aid is different. And we try to give maximum aid for the patient. And if that is not enough, then we discuss and we consult the patients and the family for the cochlear implantation, because cochlear implant is a surgical procedure. It's not like a hearing aid that just you buy and put it on. So it needs a bit of explanation and to basically get rid of the fears of the patient and the
convincing
family.
Because when we think surgery, we always think like, oh my God, this is something big. It's major. Is it going to affect me in a positive way or even more into a negative? And I know that conception, especially because when it's adult patients and we're talking about elderly patients, you know, we always think about, oh no, it's fine. You know, I don't need to, because it's the fear that you're talking about.
Yeah, because there is this stigma of hearing aid and cochlear implant we have in our society. You know, if the patient has a poor eyesight, it's very easy to tell them just wear glasses,
Very true.
and they accept that very quickly. But if they have a hearing loss and tell them that you need to wear a hearing aid or you need to do cochlear implant, they are reluctant. Say no, I don't want to do that.
Yeah.
But they feel ashamed.
Correct.
So we try to alleviate those kind of fears by showing them the devices, explaining the surgery is nowadays in good hands, a very routine operation. It's actually, most of my patients go home same day. So it's a day surgery
nice.
procedure.
Okay.
So they have the surgery in the morning, they go home in the evening. And it's become sort of a routine for a surgeon that basically operates on these regularly.
Yeah.
Become a routine operation, and by showing them some samples and even getting them to talk to some patients who had cochlear implant. And
Yeah.
this is actually very important because we have the cochlear implant group, that the patients who are very reluctant, we get them to talk to somebody who has already had
Correct.
an implant,
Yeah.
and then they can give them their journey and their experience.
I love
and
that.
and that helps.
Because
helps a lot.
you always want to hear it from, because I can't hear it from a doctor, but I would rather hear it from someone who's gone through what I've gone through.
That's true.
Who can make me understand. But I like what you said about the stigma. It's so true. I see it all the time. In fact, even I have my mother, bless her. I mean, she also has been suffering from hearing loss, but also she's very old at the moment. And I do remember, because every time we used to tell her you need to get hearing aids, she wanted to get the smallest one because she didn't want people to look at her and think that she had some sort of, I don't know why they look at it like you said. I think it's more like embarrassment, or the think that the people would look at them and consider them a little, there's something wrong with them, and then they have to start shouting when they have to talk to them. So that's true.
I think most people link the hearing loss and wearing a hearing aid with disability.
Yes, correct.
So basically, they don't want to look like that they are disabled.
100% I agree, yes.
And I think we have, as professionals and the public, we have to raise these awareness that this is not considered a disability, and you should not be ashamed to wear hearing aid, because it's very important for communication. And we know nowadays that there is very important link between depression and hearing loss, between memory loss, dementia, and hearing loss. So people who are especially elderly, that they don't accept the hearing aids and they have hearing loss, they go into their own area, and they don't like to communicate with people, and they become gradually isolated.
Do you know
and
that I've seen
depressed.
that? I have seen that. Okay, I haven't, like, I'm talking from my personal journey with my parents. So what you're saying is, I'm trying to put it into perspective, because I'm not from the medical background, but I can relate to what you're saying, because I have someone who's been suffering the same thing.
Yeah.
And what you're saying is right, because there was a time where she was like, I don't want to go visit people.
Yeah.
Because, and when she goes, she wants to take me with her, or one of my sisters, because she's like, I cannot hear what they were saying, and they're talking in very low volumes. I cannot hear, and I cannot really communicate. So I would rather just be, that is true. So I think that's the part where you mentioned, where they start keeping to themselves, and then it can actually affect them mentally, emotionally.
Yeah, definitely. And they become reluctant to ask people to repeat themselves.
Yeah.
Every time they don't understand what they're saying, and they say, okay, can you just repeat? Eventually they stop asking people to repeat themselves, and they start avoiding going out. So they become isolated, become depressed, and there is a lot of research nowadays linking also hearing loss with dementia, with memory loss. So if you don't hear properly, and you for years, gradually you start losing your memory, and this has actually been proven. So it is a very big topic nowadays in most of the conferences regarding hearing loss and memory loss.
But we're talking for the patients who don't use hearing loss or don't do the cochlear implants.
Yeah, if they don't use it, and
okay.
As I said, you really need to stimulate the brain, because if you don't stimulate the brain by the sounds and the speech, the brain start losing what is gained like memory. So I think that is very important. We mentioned to the family and the patient, and this been a point that makes the patient more convinced to go for hearing aids and cochlear implant, when we tell them that this can happen to you, you could
Yeah.
lose your memory
Yeah.
if you don't amplify
And
the
that would
sound.
scare them to even want to be
Yeah,
like,
we
okay,
don't
you
want
know.
to scare the patients, but we usually use that in the counseling, especially if they are really suffering and they don't accept the hearing aids and the cochlear implant. We try to convince them
All right.
these ways.
So now that we talk about the patients and convincing them, I just want to understand, what is the typical patient journey from the time that we talk about diagnosis to implementation? What's the...
So basically, the patient comes to us
Okay.
not being happy with their hearing aids. They get assessed, as I said, make sure that they're getting the best hearing aid that we can provide and the best program that they can have. And if they go and come back and they still I'm not happy with the programming and the hearing aid is not benefiting me, then we consult them for cochlear implantation. We explain everything to them, what the journey of cochlear implantation. And then we have to start doing some investigations. So we usually do a CT scan
Okay.
to look at the cochlea. And one of the advantage nowadays that we can actually measure the cochlear implant size.
wow.
So every person has different cochlear implant.
Yes.
Cochlear implant size, cochlear sizes are different in different people. So,
Yes, correct.
so we individualize the implant. That is one of the advances in cochlear implant. We measure and we order the implant according to the size of the cochlea. And this has been a quite important advance in cochlear implantation. After that, after we investigate fully the patients, we usually book the patient for the surgery.
Right.
We discuss the type of implant that we're going to provide for the patient. The patient has to see what are the devices and how it looks, and then after the implant, obviously the patients usually we can quickly after the implant activate the implant. So
Right.
the implantation is actually in two parts.
Okay, I was going to ask you that
yeah.
next. Can you please let us know a little bit about
Yeah,
the...
so the cochlear implant, everybody thinks it's just one device. It's not. It's
Oh,
a
it's
two
not?
device. Yeah.
Okay.
So it's a device that is implanted by me, by the surgeon.
Okay.
This is the internal device. Okay.
So this goes inside the
inside
ear.
the patient.
Okay.
And it's not visible from outside.
Right. Okay.
And then there is a processor, which is the external device that takes the sound and puts it into the internal device.
Oh, wow. Okay.
So this is called the processor. And the two parts obviously has different function.
Okay.
So the internal device we implant in during the surgery. And it's actually the internal device has like a wire that goes through the cochlea and turns in the cochlea.
Okay.
Okay, so we implant that.
Right.
And after the patient heals, usually it takes about a week, and the patient wounds and everything, the swelling, everything goes away. Then we can put the external device on. And what we call this an activation. So
Okay.
basically we activate the device by putting the processor on. And it actually attaches with a magnet through
Oh.
the skin. Yeah, so it's a magnet that captures the internal device.
Very interesting.
So this device is activated, and the activation means that we have to program it in a way that the sounds is at very beginning is not too loud for the patient.
Yeah.
So they gradually increase the intensity, and they program it such a way that the patient accepts and uses the implant. So what does the processor do actually? The
Yeah.
processor takes the sounds.
Because I was just I was going to ask you,
Yeah.
is it similar to, because you said that you have to put a processor outside. So how do they
So
wear
the-
it like a hearing aid?
Yes,
or?
exactly. It's like a hearing aid. There are different types of external processors and the different sizes, and but it is similar, very similar to the hearing aid. But
Okay.
the difference is the hearing aid gives you noise. Okay.
I was going to ask, that was going
Yeah.
to be my next question to
So
you.
the hearing aid catches the speech, amplifies it
Yes.
as a speech, and gives you the amplified noise.
Okay.
But the cochlear implant is different. It doesn't give you noise. It gives electrical activity. So there's difference. There's acoustic or sound stimulation. We call it acoustic stimulation. And cochlear gives electrical stimulation. So there's two types of stimulation for the ear.
Right.
So with electrical stimulation, there is a training is needed for the brain to start learning that these electrical activities are actually sound.
Okay.
So there is a process of rehabilitation after the operation. So it's not that we put the processor on, and the patient immediately.
That's what I thought.
Yeah, immediately hears everything clearly. No.
Okay.
Yeah. So the brain has to adapt and start learning that these electrical stimulations are actually sound.
Right.
And interprets it as sound. And the journey is different for people who have never heard the sound before, and people who already talking and they have heard sounds before, and just recently they lost their hearing.
Right.
So for children who are born deaf and mute,
Uh-huh.
the rehabilitation takes a long time.
What is long? Define long.
Like about 2 years.
Okay.
So,
and for someone
it's like a child which is born
learning how to walk, learning how to crawl.
So
yes.
how long does it take for a baby to talk? It takes 2 years.
Yes.
So the baby starts saying the first few words at 2 years.
Right.
So it's the same thing as if they are newly born. So
Wow.
when we implant them, as if they are starting from zero. So they start talking after almost 2 years of rehabilitation. They start giving speech. And speech and hearing is really much
Connected,
linked together. So
100%,
if you don't hear, you will never speak.
Correct.
So
What about the adults?
The adults already what we call the postlingual. Basically, they have developed the language.
Yes.
So if they are developed the language, then they lost their hearing. The rehabilitation is much more quicker because they don't. You really don't. The brain doesn't need to learn speech.
Right.
It just needs to learn these electrical activities as a sound,
Right.
and the rehabilitation sometimes takes 3 months, sometimes 6 months, depends on the patient. But they start quickly learning that this is speech, and really they will be amazed the difference between the implant and their hearing aid, because the hearing aid they were struggling to understand speech. Now they hear the speech and clearly they can understand people. So it really makes a big difference. And quite a lot of times we have patients come to us saying, I want to do the other side as well. So we do one-sided implant and they want to do the other ear, because they feel the difference between the side that they're wearing hearing aid and the side with the cochlear implant.
Yeah.
I just had recently a teenage girl who lost her hearing gradually. She was only 12, and she was struggling at school. So we implanted one side because the other side was not too bad.
Right.
She was using a hearing aid on the other side, and she was so happy. And the mother saying she's not wearing the hearing aid on the other side because she sees a big difference between the cochlear implant and the hearing aid. So now we are planning to do the other side soon, maybe next month. So she's and the family are seeing a difference in the school, how she's improving in her
it affects
classes.
everything. Yeah,
of course, the education is very important for children to have proper hearing. Otherwise, they will not have proper educations. They cannot progress in their education. So it's very important that we implant children also very early. If they have hearing loss in the early years, we implant them very quickly so that they can go to normal school. Because if you don't implant children who have been deaf since birth and you delay their implant, then they will end up using other means of communication like sign language. And then they will not speak and they will not communicate with the speech.
Right.
So they don't develop language. So it's very important. We aim nowadays for babies who are born with deafness to implant them before 1. So so I've implanted.
It's not dangerous?
No. I mean, we can implant children nowadays, even at the age of 9 months. I've implanted babies. Actually, there's an interesting story about an elderly lady, 80-year-old. I operated in Abu Dhabi.
Okay.
She was brought with the family members because they were struggling, shouting in the house to get her to understand, and she could not hear her grandchildren, and it was very sad. And she's wearing 2 hearing aids, but still not working. And one surgeon told her that the operation, they will split your head
Oh
open
my
and put a
God.
device in. So they were really against surgery. So when they came to me, I explained the operation, how it's done,
Yeah.
and it is so simple that you can actually go home on the same day. They started accepting, and then we had 2 or 3 sessions before she was convinced.
Okay.
And after the surgery, the family are so happy
That's good.
that house they cannot.
They don't have to shout
they-
anymore.
yeah.
She can hear.
And she's so happy to hear her
Yeah.
grandchildren,
True.
because for elderly people in our society, the main thing is to interact with their children,
True.
with the
Grandkids,
grandchildren.
100%.
So it's
yeah.
really it is really good for her, and she's happy with that.
I remember, I'm just gonna, like what you just said, the fact that you said that she becomes happy, it's true, because I remember, I'm just talking merely from my personal point of view. So my mother, I had to get her hearing aids, but at the time she had existing hearing aids, but for some reason she was not able to hear with them properly, and she was getting very agitated. And not only was she getting agitated, but like you said, it does affect the people around her, because it's like it's constantly like TVs, bless them, it's like really loud. When they speak, it's like really loud, even though you're right next to them. It's like constantly, shouting, and you have to keep repeating yourself, which is both, I think, a disadvantage for both the person who can't hear and the people, the family around. And I remember she was struggling, and it was really, she was getting very irritated. And I think the part that you mentioned, that it can lead to depression, that's something that I think I was starting to notice, but because like she was trying to, keep away from people. She's like, she felt embarrassed to hang out with women, because she's like, they can't hear me and I have to keep asking them to repeat stuff. And I didn't really like that. And I remember when I actually took her for another test when I came to the UAE, and we went and we got her different hearing aids, because apparently they had to program it, like you said. I'm just talking about hearing aids right now, because her hearing was not that bad. And I remember the first time the doctor put on the hearing aids for her and he programmed it and everything, she just walked out of there a happier person.
Yeah.
That's a feeling that especially for kids, we want to always make sure that our parents are happy, especially when they're elderly, because when we are young, they look after us. And of course, then when they get older, it's time for us to look after them.
Exactly.
And you feel when they're irritated or when they're upset. So it made me really happy to see that she was finally able to smile again.
Yeah.
When I used to play music in the car, she could actually hear it, and she started going along with the music. So it made me happy in a way. So I think that's a very important thing that we do need to understand, because a lot of people think that, okay, yeah, it's fine, they're old, they let them, but I think it's very, very important that we do.
Sometimes the elder people say, it's better, I don't want to hear
Yeah.
people. I just heard enough. I just don't want to hear. But
it affects them in the long run.
Really, in the long run, they will go into isolation, and
Yeah.
it's not good for them.
Yeah,
I
yeah.
mean, for their health, for their mental health, is really
It's
important
really
for
bad,
them.
which you mentioned earlier. So you've worked in a few patients, doctor, mashallah, yani, a lot of experience. So I do want to ask you, share with us maybe one memorable story that you've had with one of your patients.
Yeah, maybe I can go back to that teenage girl, because
Yes.
she was a special type of implant. Nowadays we have, because the implants become so fine, and the electrodes for the cochlear implants so fine, that we can actually implant patients and preserve the hearing that they have without damaging the remaining hearing that is there in the cochlea. And it is very important nowadays to implant very gently and very smoothly, so that you don't damage the residual, what we call residual hearing.
Yes.
This child actually had very good hearing at low frequency. And very poor hearing at the high frequencies. So she has difficulty speech understanding,
Right.
but the low frequency is very good. So we tried, when we did this sort of a hybrid implant, whereby we use an implant to preserve the hearing that she has at the low frequency. And now the device that she uses, she can give acoustic or sound stimulation to low frequency and electrical stimulation by cochlear implant to the high frequency. So it's a combination.
It's like a balance, I
yeah,
guess, right?
so you get like a combination of a stimulation.
Mm-hmm.
So the sounds coming for the low frequency, she can use her natural hearing in the low frequency,
Yes.
and she can use the cochlear implant for the part that she has lost.
Okay.
So it's really it's called electrical acoustic stimulation. So we do these type of implants nowadays. So there are many more patients or candidates for cochlear implant than we think. Even the patients who have good hearing and some parts of the cochlea,
Mm-hmm.
we can consider cochlear implantation. So you don't need to be totally deaf
Right.
to be a candidate for cochlear implantation. You should always approach your surgeon and approach your doctor
Mm-hmm.
to see what's the best solution for your
Right.
hearing loss.
Yeah.
And because sometimes it's a combination of hearing aid and the cochlear implant,
Right.
which can be done in one device.
Okay.
So she doesn't need to wear two devices, just one device that does both jobs at the same time.
So when you say one device that does both job, you mean I can have an implant, but at the same time also put on a hearing aid?
Yeah, the hearing aid will be in the implant device.
The processor that you
Yeah,
talked about.
Yeah, also the processor does both jobs. It gives electrical stimulation and acoustic
Oh,
stimulation.
okay. So it can also be like a
Yeah.
hybrid thing.
Yes,
Oh, that's
yeah.
very interesting.
Yeah.
Oh, wow. We are learning a lot from you, doctor, today. Thank you so much. I do have another question. This is more a little bit maybe technical. We often see that there's a low uptake rate in the hearing implants and hearing aids and the cochlear implants. What do you think is in this case?
Yeah, I think it's to do with as we discussed before, it's to do with the society, really.
Right.
A lot of it's to do with the stigma attached to the hearing aid and the disability. The pickup rate in Europe is much higher
Mm-hmm.
because the people there start understand, and this is not considered disability. You can actually rehabilitate and become a normal person.
Mm-hmm.
So quite often I tell my patients, adult patients, how come you are prepared to wear a Bluetooth, but when it
Yeah.
comes to hearing aid, you're not prepared to
'Cause
wear a
it's
hearing aid.
cool, right?
The Bluetooth makes you look cool, but the hearing aid makes you look disabled. So this is stigma
Very
there. So we
interesting
have to remove
concept.
that stigma, and
Right.
we'll with the new technologies and the hearing aids are becoming, and the cochlear implant becoming smaller and smaller.
Yeah.
The processors now, we have what we call off-the-ear processor.
What is that, please?
So the processor is much smaller and
Mhm.
it's round, and you can actually hide it under the hair, so it's not visible. So that actually encourages more of patients to go for cochlear implant
Right.
because cosmetically
It doesn't show,
Yeah,
yes.
it's cosmetically, especially for ladies. Really easy to hide
Yeah.
under the hair.
Yeah.
And if you see the patients, some patients who are cochlear implant patients, and you talk to them, you don't know that they have implant because you don't see it.
And they speak
they
well?
speak normally.
Yeah,
and
okay.
you are amazed that how come they don't hear at all, or they deaf, but with an implant they are like a normal person.
Wow.
So it is amazing, and we have to show
It's more awareness. I think we
Yeah.
need to just get people to be
I mean,
more
these kind
aware.
of programs, as well as education on TV and radio and social media, I think these are very important to raise awareness
Yeah.
for the adults. And also we said that we have to warn them also that this could lead to depression and isolation and memory loss, and that will also help to encourage the adult patients to go for rehabilitation of their hearing, and to go either for hearing aid, and depend on degree of hearing loss that they have, to go
Yeah.
for cochlear implant. And social groups like implant groups that they can
Be part of
communicate
and
with.
learn
Yeah,
from.
learn
Yes.
from them,
Yeah.
communicate with the patients' experiences, and they can also help.
Yeah, I love
Yeah.
that.
Now devices where the connectivity is also very important. So we
Mhm.
have the cochlear implant nowadays can connect directly to the mobile, to the TV,
Oh.
to the teacher even, with FM systems, and system that can processor of the cochlear implant can connect. So the Bluetooth connection, and it makes it
Wow.
much easier.
I was actually going to ask you, like, what are some of the innovations that we're seeing, like, with all the technologies happening in the cochlear implants? But I think you keep covering them one at a time. Like, you keep mentioning you're looking, like, in the near future, they're looking to have just one device, which is going to be without having the processor. They're trying to put it both inside. You mentioned the part where you just said you could connect now with Bluetooth, or you could. It's like amazing how technology is just so
The
impressive.
other amazing thing that the new development in the technology of the cochlear implant is that they can actually now the patient processor can connect to the hospital remotely, so that the audiologists they can program and sort the issues for the patients, and they're at home or even anywhere in the world. They can connect directly.
Very interesting.
So the device can connect to the center or implant center, wherever it is, maybe any hospital or the clinic, and they can be programmed. They can remotely program the device, and they look at if there is some issues, they can sort the issues for the implant. So the patient doesn't really need to come all the way to the hospital. So this is one of the innovations in the companies that develop these implants. And the other thing is that individualization of the implant. So as we said, not every cochlea is the same.
100%, yeah.
So nowadays we can actually order an implant for the patient. Say, okay, this is the length of the implant. This is the type of implant we want for this patient.
Yeah.
And the company actually develops that, and they bring that device. They produce that device, and they bring for the patient. We implant that device, which is we ordered for the patient. It's like you order.
It's like a customized.
It's to fit the cochlea.
Yeah.
Because there's a lot of research showing that if you implant a very tightly fitting cochlear implant, then the speech development is much quicker and much faster, and they can understand speech, and the sound is more clear and more natural.
I love that. I love that. It's like a lot of positivity that comes out of the implants. And again, because I'm looking at it from my point of view as a parent, having a parent who's suffering from hearing loss. Now let's talk about the UAE, because we are based in the UAE. How would you describe the current landscape of cochlear implantation in the UAE?
Okay, we can divide it in two parts. Basically, the early diagnosis of hearing loss, and there is now a universal screening for babies who are born in UAE. So all the hospitals who have basically deliveries and babies, they have to test the babies for their hearing. And so this is actually implemented in all the hospitals across the UAE, so that we catch the babies who are deaf very early. This is the screening program.
Any baby that's born?
Yeah, everyone. It's just like the blood test they do for other tests, like for thyroid and other issues that they test. So this is a screening program. So that is important, because we want to catch the babies who are deaf and mute, and they should be implanted early, as we said.
Yes, correct.
We don't want to delay that.
Wow.
So these screening program, then what happens if they are positive, or if they cannot hear, then they are referred to the centers who test them further to confirm if they they actually have a hearing loss or not, because the screening test is not that accurate. So the accuracy is in the diagnostic test that is done in the cochlear implant centers.
Right.
So these children who did not pass their screening, they are referred to our center. And we do a more elaborate tests for these babies, and make sure if they don't hear, then we put the hearing aids immediately. We will prescribe them hearing aids until they grow to a certain age that we can implant them.
Yeah.
Now, this is as far as the children. So there's been a lot of progress as far as implantation for kids in UAE. And this is improving because by law, all the hospitals who have deliveries and babies, they have to test them before they are discharged from the hospital.
I love that, because it does help.
Yeah, it does help to catch because before we used to find out later on that the child is not hearing, because it's very difficult for the parents to understand.
I was going to ask, how can you tell your
you cannot
baby
tell
cannot?
The young babies, you cannot tell until you test them.
For
Unfortunately, for adults,
adults
for adults, there has not been a lot of progress. Still, the pickup rate for cochlear implant in adults is low in UAE.
Why do you think so?
I think it's still to do with the stigma of hearing, the implantation, the surgery, the fear of surgery, and they keep sticking with the hearing aids, thinking that
That's the only solution.
and the fear that they have to go undergo surgery might not be successful.
Yeah.
So we try to alleviate those kind of fears by what we already explained, with sessions of counseling with them and with their family
Which
members.
you mentioned, right?
And there are a lot of adults nowadays that they get convinced, and they, as we said, the group of implantees you get bigger, the word of mouth itself
100% makes
does
a difference.
help. It makes a difference, because
yeah.
when they talk to their family members, other their friends that they have struggling with their hearing loss, they raise the awareness. And I think it is important that we tell everyone, especially the adults that are suffering and they are not getting enough from their hearing aids, these solutions are available. And it is really simple. It is very routine, and the surgery is not big, and they should try to go to the implant centers and get the advice. Yeah.
I think we've covered pretty much all the information, or I said a lot of information that someone who's not from a medical background would like to understand. I wanted to ask, because you just mentioned something that's very important. So with the closing, what sort of closing remark do you think you would love to give anyone who's suffering from hearing loss, or someone who wants to go ahead with the surgery but is a bit, I would call it an implantation. What advice would you give the viewers, the listeners out there who are suffering from hearing loss, or who know someone who's suffering from hearing loss and would like to proceed with such a procedure?
Yeah, I think the advice that I can give to everyone who has a hearing loss and suffering from hearing loss is that you find a center that dealing with the hearing loss first of all. And there are several implant centers in UAE, and you go to a reputable center and listen, and don't lose hope, because there is always solutions. And if you go and listen to the doctors and then the people who have had the implants and look at the procedure, you will find out that it is very routine, very simple, and the results are excellent. And you will be amazed the difference between the sound that you hear from an implant than the sound that you hear from hearing aid, where you're not understanding people. And you should never give up hope, because there is always solutions for these kind of problems.
I love
and
that.
we can provide that.
Dr. Ahmed Al-Imadi, thank you so much. I appreciate you taking the time and answering the questions that we know we had. Ladies and gentlemen, that finalizes the first episode of Medal's podcast right here with Dr. Ahmed. And we will be back with more and more podcasts, so stay tuned.